Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and I want to welcome our guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, recognized as the 2010 Book of the Year by the American Journal of Nursing, right? Got it right this time. Fran's book is also where we derive the most of the questions and meat for our shows each week. We're going to vary from that just a tiny bit by focusing on a couple of articles that I found, Fran, and sent to you. And these articles, as I mentioned prior to the show, kind of make my blood boil because they kind of look at the obvious and act like nobody else has discovered this. And so we'll go into these, and I'll give you my take on it, and then we'll let you provide some clarity and comment and some sensibleness to my feelings on it. But both of these came from Fierce. I think it's Fierce Healthcare. I'll post the articles in the show notes. But it says in one of them. It talks about patient activation influencing readmission rates. And when I saw the headline, I thought, well, what the heck is patient activation? You know, that's some kind of new thing that somebody discovered. And when I read into it, it says hospitals should add patient activation to their list of readmission reduction strategies. According to a new study by the Journal of General Internal Medicine, they found patients possessing a high degree of knowledge, skills, and confidence in self-managing their care were less likely to return to the hospital within 30 days.
Ooh.
Yeah. And they found that they studied 695 patients and concluded that the 30-day risk of readmission was almost twice as high for patients with low activation levels. So I think, and they were also more likely to return to the emergency department as well within 30 days. And my take on this is, number one, that's common sense that most everyone already knows, and that they have created a new term, a code for patient education. They call it patient activation. So I guess I'm a little frustrated by that because it's taken something that's common sense, it would be easier for people to relate to, and trying to make it hard for people to relate to. So, talk me off the cliff.
Well, I agree with you. I think there's a tendency to come up with new jargon to get people to pay attention to stuff, and they may think patient education is old stuff and not worthy of talking about anymore, but that's exactly what they're talking about. And it's interesting that as you were reading that, I was thinking a while back, quite some time ago, I had summarized all the research in patient education down to involve and individualize. And that's exactly what they're talking about. Involve the patient in the process and individualize it to their needs.
Yeah, exactly. Let's see, there was another quote in here that I think it was in the related study this comes from. Here it is. To increase patient activation, providers must know patients' ability and willingness to manage their health care. Well, it's not new.
That sounds like assessment. Yeah.
Yeah, it certainly does. Here's another quote from the article. Patients who have more knowledge, skills, and confidence in managing their medical care have better outcomes.
Kind of common sense.
Yeah. Yeah, it really is. And it also said that activated patients are more likely to engage in healthy behavior. In other words, the more you know about something, the more likely you're going to do something to take care of it. And, it's like, yeah. And they created a new term, a new acronym that, you should promptly forget, I think. It's called PAM. PAM. It stands for Patient Activation Measures. Another code for patient education. I guess they don't want to use terms like teach back and assessment because they make sense. I don't know, but I don't know. What do you think?
I think it's easier to publish when you think you're saying something new and exciting, but at least it reinforces everything we've been saying all along.
Yeah, yeah. There's no doubt about that. I mean, I guess on the bright side of this is that they are providing data that supports the premise that you've had for years, and that I certainly share. Being on the receiving end of it, that patient education is important. It's not something that you can be ignored. Now, I will give you. Let me get your thoughts on this. There was a troubling quote that I found at the end of one of these articles that kind of gave me pause. And I'll let you comment on this too. It said hospitals also can consider patients' internet use when deciding how much to involve patients in medical decision making.
That makes no sense to me whatsoever.
Yeah. It's like I thought that patient-centered was all about involving the patient, and now we're going to ask how much they're using the internet before we decide if we're going to let them participate in decision making.
That just makes no sense. I can't.
Okay, good. Well, at least you had the same reaction to it that I did. Yeah, it's this. Here's another. The second half of that, it says, given patients who use the internet more frequently are more likely to embrace patient-centered healthcare efforts and participate in their own care. I'm not sure you could point to the internet for that. I mean, anybody that's interested in learning about what's wrong with them is going to embrace and participate, don't you think?
There are a couple of odd things in that sentence. Yes, absolutely. You don't need the internet to be a participant in your own care.
Right.
And you also don't need the internet to provide patient-centered care. That's completely separate. Yeah. Patient-centered care is what you do as a healthcare provider, and how the patient learns about stuff and applies that stuff to his own self-care is kind of separate.
Yeah, yeah, it really is. So in a nutshell, what's the fundamental basis that these articles are trying to tell us?
I think what they're saying in completely different terms is that patients who care about how to take care of themselves and want to do a better job will do that. And when they do that, they actually have better health outcomes than people who don't care about taking care of themselves better and don't value that and don't bother to learn better ways to self-care.
Yeah. And of course, there's a message to patient educators as well, and that's what?
Assess and find out where the patient stands. And coaching obviously helps. So if you explore with them what their issues are and what their concerns are and what their motivators are, you have a chance of moving them forward in the process. Yeah.
And information on how to do all of those things not only is in some of the episodes that we cover on the Patient Educators Update, but the true concise version of it is in your book. So if someone is interested in wanting to learn how to be a better patient educator and overlook some of the gobbledygook and get down to the nuts and bolts of what it takes, they should go buy your book.
Well, thank you.
Yeah, so with that, why don't you tell folks how they can find you online?
Well, I talk about all these same issues on my blog at www.notimetoteach.com, and I'm on Twitter at NoTimeToTeach.
Yeah, and Fran's book is available at bookstores, both online and in paperback form. And if you are interested in using her book to provide in-service training for groups, you can make a purchase, a bulk purchase from her publisher directly and save about 40%. And her publisher is Pritchett and Hull, and they can be reached on the internet at p-h.com. And so we would encourage you to take a look at that. And for those of you who are fired up about patient education and really want to do some stuff to make it better, you can add video on demand to supplement what you're already doing. And to do that, you can reach us through our website at synergybroadcast.com, or look up our patient education video on demand system we call MMDS, or Medical Media Delivery System. And you combine the video with the handouts and the other things that you're doing, and you can do an awful lot to reduce patient readmissions and make happy patients at discharge. So Fran, I think it was a interesting episode. We'll see how many more articles come out like that, and see how many different ways we can name patient education.
Sounds like fun.
Okay, so take care. I'll talk to you next week.
Okay, bye, Chuck.
All right, bye-bye.